Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today we welcome Perrette St. Preux. She's a nurse, and today's Kevin MD article is Work-Life Balance in Healthcare. Is it a need or a necessity? Perrette, welcome to the show.
Thank you for having me, Kevin.
So let's start by briefly sharing your story and journey.
I was born and raised in Haiti. So from a family where nobody was in the medical field. But at the early age, I knew that I had to serve like in a meaningful way. And I made my way to medical school. So I graduated from Notre Dame University. Short after, I moved first to the United States. Then I went to Canada, where I went back to school to become a registered nurse and earned a master's degree in public health, specialization in health systems and policy. So working as a nurse with that background in health system and policy helped me to understand so many things and seeing the suffering of my colleagues. So that opened a new path for me to become now a writer and also a coach, a life coach, where I help healthcare workers to create balance in their life.
All right. And when you say that your colleagues, your fellow nurses are going through a lot of burnout and you're a life coach for nurses, tell me some of the stories that you're hearing from your nurse colleagues.
Actually, I see so many things. For example, I have colleagues that all the time they are doing like on and off. They come, they go in burnout, and after 3 months, 4 months, 6 months, they are back in the job. And you can see them going, and you know in a couple of months again, the same thing will be repeating. So what I heard is everybody's tired, everybody wants change, everybody want to see different things, but they are anchored to what called them to that field, the purpose, the passion that they have for it. You can see them crying, but they can't let go because the next day they're going to come back with the same joy and like desire to serve. And then the next day again, they're going to cry. They're going to feel like burnout, exhausted. So that's something that really touched me, but I don't really go in that far in the situation because not only I have a medical background that helped me to manage my stress, and I'm usually somebody who's like, I manage my life. So I see when those that I help, I see the difference in the way they practice, in the way that they approach their job. So that's why I said that, you know what, I think I'm going to do my best to help the more people that I can to realize that our health, well-being is our responsibility. The moment we take that responsibility and we're going to see our job differently, and we're going to be able to manage not only the job, but also our life better, and which is what everybody's looking for, Kevin.
So let's talk about your Kevin MD article where you delve more into this. It's titled Work-Life Balance in Healthcare. Is it a need or a necessity? Now, for those who didn't get a chance to read your article, tell us what it's about.
The article is about creating work-life balance. I want to help healthcare workers in general, nurses, doctors, and whoever's working in healthcare to understand that when we are talking about wellness, we heard about wellness. We heard about that we need to build resilience, but we don't really heard about balance. And there can't be wellness, there can't be resilience without balance, because balance is the vehicle that helps us to sustain every effort that we are doing to be well in our lives. So I want them to hear more about balance. So the article is, I show them what happened when I was out of balance and the difference that I see in my life and in my environment the moment that I reach balance. Sometimes it takes like an event that I shared in the article to realize that I'm out of balance and I need to do something. But we don't have to get there. We don't have to wait for something to happen to understand the importance of balance in our lives. So the article for me is a wake-up call. I want to insist as much as I can so many people can hear it and we start acting on it, because we are in a crisis of burnout. I believe balance is the solution.
So, for those who didn't read your story, just tell us what was the event that made you realize that you were out of balance?
I am a single mother. So, and then I was a doctor in my country. So I came to North America. So it was a lot of pressure. Do I want to start over? Do I want to continue in my medical field? So I had to make a choice. It's a lot of pressure on me. It's a lot of stress. And then I went to nursing school. Again, a lot of pressure. So when I started to work as a nurse, that's when I get separated from my husband. So it was new for me to be a single mother. I was in Canada away from my family. So I had to manage everything. And I realized that I was really stressed.
Mm-hmm.
So my job is something that I really cherish, something that I really love what I'm doing. But I couldn't do it properly because I had too much stress in my life. So one night, I was with my son, and then I felt a chest pain, what we really call like excruciating chest pain. And I know the symptoms. So I grabbed my phone to call 911. And that's when I realized I have my son next room and I don't have anybody to call. So with tears in my eyes, I couldn't even breathe. I was like, with like very short breath. Mm-hmm. And I say, God, please, no, not now. I say, not now, please, please. And then while I was begging and then breathing slowly, I might fall asleep. The next day, I say, you know what? I need to change something. But at my job, they couldn't give me a day shift because I was working evening shift. So I insist. I call HR. I talk to my boss. I said, like, I need to do something. I don't wanna leave my job because this is my passion. This is the only thing in my life that brings me joy. But I need to do something. So with insistence, finally, I got a day shift. And then that's when I started to work on myself. And I knew that balance was what I needed. And I read books, webinars, and everything. So I did it, and I can see the difference. When I go to my job every day, no matter what it looks like, my joy is too high for whatever is happening in my job to like put me down. Mm-hmm. So yes, I feel frustrated. Yes, sometimes I'm physically exhausted, but my mentally, I am so well that I don't see anything that can get me out of this field.
So you told a story where you had excruciating chest pain, and that made you, of course, realize that your life was out of balance. When you talk to other healthcare workers, what are other stories that they tell you? What are other symptoms that they tell you to make you realize that, hey, your life is out of balance? What other symptoms are you hearing from them?
Sometimes is you see it like live at the job. You're gonna see, I see my coworkers hiding in the bathroom, crying. Mm-hmm. After work, you can see them like going in the elevators. Everybody's like, okay, crying. Other time, you're gonna see them, tomorrow I'm not coming because I can't take it no more. Mm-hmm. And then you're gonna see them sometimes they're coming to work in the morning, their face is like boofy, and then they don't feel like in the job. But actually what I really hear very often is like, I'm exhausted. I can't take it no more. I need a way out. I have my sisters and my sister-in-law, they are nurses too. Every time, every day after work is the same thing. You know what? I need a way out. I need to go back to school to do this or to do that. I need a way out. I can't take it anymore. So that's the thing that I'm hearing more often.
And after talking to them, what are some of the reasons that cause them to cry in the elevator or make their life out of balance? What are some of the reasons they tell you?
It's the workload, lack of support and lack of understanding, and also not being able to have enough time to renew themselves, to recharge, because we need it, but they don't have enough time.
And when you talk to them and you coach them, what are some ways that you're telling them to try and get their life back in balance again? What are some of your techniques?
What I did is like I developed an approach where I explain what we need to create balance, because there are three things in my opinion. We're talking about wellness, we're talking about resilience, and we're talking about balance. So they are not things that you can realize. You can be well. We're talking about health wellness, where they are spending millions in creating wellness program, but the wellness, you cannot be well at work if you're not well at home. Mm-hmm. So with my clients or friends, I told them that balance is something that you start from within. It's an intentional approach. You need to, what do I want? What do I want? I want to feel well. We don't need anything perfect. when we talk about balance, it's not being extraordinarily well in your life. It is getting to a point where you feel fulfilled. Mm-hmm. You feel the passion and you can manage all the aspects of your life. I say that wellness is all the efforts that we are doing to feel well, like eating well, sleeping, and then do exercise, do meditation, whatever you want to do. That's all wellness takes. Now, you need balance to do what? It is to sustain that wellness. But if I'm doing well, I'm doing meditation and everything, but the situation, I don't have time to even practice what can keep me well. So there can be balance in your life. So what I do is like I have them say, what is it that you want? When you know what you want, and then I want you to know now, because this is the question that I insist on in the article. How am I doing? Mm-hmm. When you say, how am I doing in every aspect of my life? You're going to take your work life. You're going to take your private life. You're going to take everything. How am I doing? When you know how we are doing, you take acknowledgement of where you are in your state of balance. And then now, what is it that I need? What is it that you need to feel like renewed, to feel recharged and stay connected with your passion and your purpose? Because your purpose is what keeps you going no matter what. It is what helps you to build resilience. Mm-hmm. But your passion is the motivation, is the fuel, what really drives you to what you are doing. So when we work on this wellness, passion, purpose, and then now what is it that I can do? What is it that is beyond my control? So you have to identify this. What are my limitations? What are the boundaries I have to set to get to that point? And then now we are in healthcare. So we know it is imprevisible. There's a couple of things that you don't know. These are the things that are out of your balance, out of your control. So you need to know also when this situation happens, what can I do to get back to balance? And I explained to you that balance is only the how. How can I take every aspect of my life and manage them? It is managing your time, your energy, and your attention, and then distributing them in different aspects of your life. And when they practice little by little, it's not something that you do once and then it's okay. It is something that you have to practice, continue doing it. And little by little, you're going to see the difference. And when you see difference, you're going to keep on going and you will not want to lose it. So this is why I explained to them.
So give us a case study, story, or an example where someone came to you and you implemented some of these techniques and you really moved the needle in your lives. Can you tell us a story where resetting and improving that balance improved and moved the needle in that healthcare professional's life?
Yes, I have a coworker, and then I saw her going. She's really compassionate. She's a really good nurse. And then I saw her going. She's always giving her best and then giving a little bit too much. She never take her breaks. And then I talked to her after work. I said, you know what? I keep on watching you. If you keep on doing what you're doing, you're gonna burn yourself out. Mm-hmm. And then she said, like, okay. And I give her something. She was trying to explain to me why I can't take my break, why I can't. I said, like, okay, the reason you explain to me, they can't help you prevent burnout, but you can prevent it yourself. And then after a couple of weeks, I didn't see her. And I went on vacation. When I came back, she wasn't at work. And then one day I received a text message. She said that, Perrette, I don't know if you heard, but I am out of work. I'm in sick leave. I was like, what's going on? She said that I couldn't take it anymore. I was crying. And then I went to my doctor and then I was diagnosed with personal and professional burnout. Mm-hmm. And then she said that because I wrote a book that is called Give and Receive, How to Serve in Healthcare Without Neglecting Yourself. So she said like, actually, I'm reading your book. And I also had a couple of podcasts that I did. She was like, I'm listening to your podcast and I'm crying because whatever you were saying, this is exactly why I'm in burnout right now. Mm-hmm. So I offer her to coach her for free, which I did. So I went with her for 3 months. I met her where she was. And then I was amazed because I know her. And I said that I know you can do it. Sure. And then she worked with me really. And then now just seeing her or hearing what she's saying about herself. And then she was able to go back to work as a nurse, but she's still looking for her way out, but she's doing really well. And I'm proud of that. Every time I have the chance to help a nurse, a CNA or an LPN, whoever that I'm able to help, I really appreciate that because I know that I'm still making difference in people's life, but now I'm touching more lives through the healthcare workers.
We're talking to Perrette St. Preux. She's a nurse, and today's Kevin MD article is Work-Life Balance in Healthcare. Is it a need or a necessity? Perrette will end with some take-home messages that you want to leave with the Kevin MD audience.
What I really want to say to all healthcare workers is like, our health and our well-being is our responsibility. We heard about wellness, about resilience. There's no way we can build them without balance. Balance is not perfection. It is being able to really distributing your time, your attention, and your energy in all aspects of your life. Unfortunately, it is not something that somebody can hand to you. It is something that you have to act on it proactively. Now is the best time to do it. The populations, they need us. The patients, they need us. The family, they need us. But we need to stay strong to be able to continue serving with purpose and passion. So by building resilience, you're building your power. And this is all I want you to know. And you can do it. You can do it.
Perrette, thank you so much for sharing your perspective, insight, and wisdom. And thanks again for coming on the show.
Thank you for having me, Kevin.